At my 20-week anatomy scan, which I had done through the high-risk OB doctors, we ended up finding out that Caden had a large lymphatic malformation of the head and neck, and that he would have to be born through exit procedure.
Caden and Kimberly came to us whenever he was not very old at all. The first call that we received from Kimberly was very frantic, and she had not slept in days, which would be very understandable. She was exhausted, so what we tried to do was get nursing care established for them. So that was the first thing we did for them, was find out how we could put into place private duty nursing. And then we got Caden on the MDCP waiver and helped establish respite care for him, and that has been instrumental for them as well. He's currently receiving 24/7 nursing care in the home.
Lainey was the person that felt like she worked tirelessly around the clock until I started having help in the home. If I hadn't had her, I don't know how this process works. I don't know how MDCP works, with Medicaid, and she was able to just really decode everything for me and answer all of my questions. I could not have survived coming home from the NICU with Caden if I hadn't have had her in my corner and on my team for sure.
Anything that we can do to lessen the burden and for them to be able to stop and be able to spend a few more minutes with their child, taking care of their child, or just spending time with their child instead of having to be an administrator of their life and all of the things that need to be done.
I have actually really loved having respite care because it allows me to still be Caden's mom. It's great to have private duty nursing, but because of my unique specific situation, having another special needs child in the home that requires my 24/7 care and attention, respite care allows me to bring someone into the home that can help ease my burdens and allow me to still be very present in Caden's life.
It's always very rewarding to have a parent tell us, I would not be able to live my life without the help that you've provided to us. And particularly in this case with Caden, it's very near and dear to my heart.
Having Lainey as our health plan coordinator has been a godsend. I don't feel like I even view her as a medical professional. She just feels like one of my best friends and biggest advocates. It's almost like it's just one giant family that can all come together and work in a network that ends up being the best for the child's care.